Hello, everyone. My name is Candace Cousins-Hopkins, and I am the Assistant Director of Marketing for Special Events at St. John's Riverside Hospital. We are so glad that you could join us for our last webinar of our series. We apologize for the technical difficulties we had a couple weeks ago, but we're so glad that you decided to tune in today because we have a terrific presentation in store for you about stroke awareness and what you should know. A stroke, as I'm sure many of you know, is one of the leading causes of death in this country. And so knowing the risk factors, the warning signs, and the treatment options are vital to us all. Before we get into the presentation, I would like to introduce our partners and thank them for supporting us with spreading the word about these webinars. Sally Pinto, who's from the Yonkers Nork, the neighborhood naturally occurring retirement community that is under the umbrella of the Yonkers Office for the Aging and Westchester Jewish Community Services. Nork provides programs, activities, and services, including nurse and resource specialists to seniors, plus living in Northeast Yonkers. And Z Baird is also here with us. She's from the Yonkers Public Library, which has 3 locations, Riverfront, Will, and Crestwood. Please visit their website for hours of service, free programs, downloadable books, streaming movies, and more at www.ypl.org. Now, I would like to welcome our special guest, Linda Sugrue. She holds a BS in nursing and has been the stroke program coordinator here at St. John for 5 years. She is a credentialed stroke certified registered nurse by the American Board of Neuroscience Nursing. Has an extensive background in telemetry nursing and emergency department nursing, and she's also the nurse leader of the St. John's Riverside Hospital Primary Stroke Center. We are so lucky to have her with us today because she's an excellent resource and is so knowledgeable in her field and is just so passionate about this subject. After her presentation, we will open up our Q&A segment to give you all the chance to ask Linda questions. So Linda, whenever you're ready, please get started.
Thank you so much, Candace. So many nice things. Welcome, everybody. Again, I am Linda Sugrue. I'm so happy to be with you today. Thank you so much for joining us, especially this is a rescheduled day, so we appreciate being together with you. So I'm happy to be talking about such an important topic with you today, and that is stroke. As Candace mentioned, I'm the coordinator of our program here at St. John's, and some backstory into the program. We are currently a New York State certified stroke center, and we're certified by the Department of Health, the New York State Department of Health. And this is an especially exciting time for us here in the stroke program as we are growing our program into a Joint Commission certified primary stroke center as well. So this is a very exciting time for all of us. Our stroke team is made up of many disciplines here at St. John's that work together to meet the needs of our stroke patients. And they range from emergency care to inpatient care, testing, education, rehabilitation, just to mention a few. There are plenty more. And as you saw on your screen earlier, this year again, we've been awarded the Gold Plus Stroke Award by the American Heart Association and American Stroke Association for stroke care excellence. So we are very proud of that recognition, and we are so honored to be serving our community. So let's get into talking about stroke. As Candace mentioned, stroke is one of the leading causes of death in the United States, currently the 5th. And the leading cause of long-term adult disability in the United States as well. So some sobering statistics there. It is a serious disease, one that we've learned a lot about over the years in terms of recognition, treatment, prevention, and we're going to talk about that, and some other important facts about stroke as well. So we don't ordinarily think about the actions of our body, right? Every day we just do them. Walking, talking, maybe doing hobbies, crafting with your hands like some of us do, climbing stairs, chewing and swallowing your food, right? Everyday actions of our body. We don't think about them, we just do them. Well, that's your brain. Your brain is responsible for that. And different areas of your brain are responsible for different functions in your body. So for example, the left side of your brain is where your speech center is located. The back part of your brain is responsible for your balance and your vision. So Damage to different areas of the brain will change the functions of those parts of the body that it controls, and we call that a deficit. We call them deficits. And when that damage occurs to the brain, that's exactly what a stroke is. And that damage and those deficits can result in varied levels of disability after stroke. And this is a main reason why stroke is so serious, because those disabilities can negatively impact what we call functional independence, right? So these are your activities of daily living, the walking, the talking, the driving, what we just talked about. So the potential to be life-altering for a stroke patient, right? So it's very, very important to prevent stroke from happening. And when it does, to swiftly act to treat it. So we'll first talk about how stroke occurs. Now, there are two kinds of stroke that you should know about. One is ischemic and one is hemorrhagic. We will mostly be focusing on the ischemic stroke today. And the ischemic stroke occurs when there's a loss of blood and oxygen to the brain. A hemorrhagic stroke occurs when there's bleeding inside the brain, right? So when one of the vessels ruptures or leaks and blood gets into the brain. But both have to do with the blood vessels in your brain, right? Our body and our brain need blood and oxygen to survive in order to function. And blood and oxygen travel through the body through our blood vessels. So any interruption to the blood flow in those blood vessels can compromise that oxygenation that our body and our brain need to function. So think of a garden hose when you're watering a lawn or plants. If you step on the hose or it becomes kinked or blocked, the water doesn't get through to the garden effectively. So similarly, when blood travels through a blocked or narrowed blood vessel in the brain can't get oxygenated effectively. And this is what leads to brain cell damage and brain cell death. So the health of our blood vessels is extremely important when we're talking about stroke. Now, there's a special thing you should know about brain cells. Brain cells are extremely delicate, and they begin to die right away when they are void of oxygen. In fact, for every 1 minute of stroke, we lose about 2 million brain cells. That's a lot of brain cells in 60 seconds. So you may have heard the expression time is brain. You may have seen some billboards up on the highways about time is brain. Well, that's where the expression comes from when we're talking about early recognition of stroke and the treatment of stroke. So if our vessels and the health of our vessels play such an important part in stroke, how do we keep them healthy? What should we do? And this is where risk factors come in. And a risk factor is something that increases the chance of developing the disease. And they're broken up into modifiable risk factors and non-modifiable risk factors. So non-modifiable risk factor is something that you can't change. So for example, your age, your medical history, your family history, right? You can't change those. They're not modifiable. Versus high blood pressure or high cholesterol, for example, which are modifiable risk factors, right? We can change them. We can implement dietary changes, we can add medications, we can exercise, that sort of thing. And it's important and helpful to know what the top risk factors are for stroke. And as many of you may know already, high blood pressure is one of the top risk factors. Additionally, we have diabetes, high cholesterol, atrial fibrillation, which is a cardiac arrhythmia, smoking, obesity, inactivity, and excessive alcohol consumption. So as you can imagine, managing these risk factors is very, very important in preventing stroke. So how should we do that? How do we manage these risk factors? Well, there are some strategies that I'd like to share with you today that you can start implementing today. And the first is to see your primary physician or provider and see them regularly, right? This is part of primary prevention. So primary prevention is something that you do to protect yourself ahead of time. So something that promotes your baseline health. So a visit to your doctor or physician could include physical exam, vital signs, your blood pressure, your heart rate. It may include lab work right? And some of the labs that we would be looking for, your blood tests, what we would be looking for would be your LDL, for example, which we like to be below 100 at baseline. And if you've already had a stroke, we like it to be around 70 or less. Similarly, an A1C or hemoglobin A1C could be tested to check you for diabetes. Your provider may do a baseline EKG to see what your heart rhythm is looking like. So you get the idea that these are risk factor screening techniques and strategies in fact finding, really to help you stay healthy. So I have to be responsible and bring up COVID because there are many concerns about going to doctors' offices in the current healthcare environment with COVID. And like us here at St. John's, many of the medical offices and staff are implementing COVID safety processes that are such as wearing masks, symptom screening, taking temperatures, using hand sanitizer, maintaining physical distancing, right? Even virtual visits. Telemedicine may be a better option for you, so it's important to mention that as well. So that should not keep you from seeing your physician, right, or your provider. It's very, very important. Another important strategy is for you to take your prescribed medicines as they are prescribed if you are on medicines. They're there for a reason, right? Your medications, your regime is custom made for you. Your provider has ordered them for you for a reason. So keep on track with them. Keep track of when you take them. Keep track of your refills so that you never run out of them and have to skip a dose. And pharmacies now are offering quite a few conveniences as far as services. So some pharmacies are implementing reminder calls for refills. Some pharmacies are even offering drive-through pickup service to pick up your medications. And I know that our pharmacy here, Sunlight Pharmacy, actually does home delivery of prescriptions. So these might be an option for you to help implement that strategy. It's also a good idea, talking about medicines, that you keep a current list of your medications, right? That you keep it up to date. So either in your purse or your wallet or your phone, keep a list so that you know what medicines you are taking. And it's especially helpful in times of emergency to be able to take out that list, particularly in stroke, so that that information is readily available. In fact, one of the main questions that we ask when we have a suspected stroke, apart from when did your symptoms begin, is what medications are you taking? So I can't underscore it enough how important it is for you to know the medicines that you're taking and have them available to share. And this mode of prevention seems pretty basic, and sometimes it's the hardest to do, and we all admit that. It's all about making good choices in life, right? What you put into your body, how you treat your body, eat a balanced diet, exercise, talk to your provider about an exercise regime. You don't have to run a marathon, but it's about keeping your body active, and it's about getting that heart rate up. That's what we're looking for. So in real time, how can we implement strategies like that? Well, maybe take the stairs at work one day, or in your building, if you're on the 8th floor, maybe take 2 flights of stairs and then get on the elevator, right? Walk around the block, dance in your living room, be innovative. It's important to keep your body moving and keep your body moving regularly. And finally, and I find this to be one of the most important strategies in prevention, is to learn. Talk to your physicians, read, ask questions. The American Heart Association and American Stroke Association have a wonderful part of their internet page where you can find helpful handouts and flyers about stroke, the kinds of stroke, the risk factors of stroke. Attend webinars like this. Knowledge is power, and knowledge can steer you in the right direction to make better choices. So we've talked about causes and prevention of stroke. What do we do when stroke actually happens, right? That's a huge question. So very important to understand that stroke is always an emergency, always. And we lose 2 million brain cells. Remember, we talked about that at the beginning. So this is not a time to wait and see if your symptoms go away. And so what symptoms are those that I'm talking about? So we're going to pull up a graphic for you that's going to help you understand from a visual perspective. This is the American Heart Association FAST graphic, and each letter represents a symptom or an intervention. And we'll start with the letter F, right? So facial drooping. When someone is having an acute stroke, one of the most common facial manifestations is a facial droop, and as you can see under the letter F. And then A is for arm weakness, right? Arm weakness to an extremity, either an arm or a leg, particularly one side of the body, and that would be your A. And then S is for speech, so difficulty speaking, trouble getting the words out, or even producing words, or producing words that don't make sense, would be your S, so FAS. And then T stands for time, and T means time to call 911. So seeking medical attention by calling 911 without delay is really the point of this graphic, right? We need to think fast when we suspect a stroke. Now, you also may see incidentally out there is a similar graphic to this where a B and an E is tucked onto the front of FAST, and that's also wonderful. Remember, we talked about the back part of the brain is responsible for your balance and your vision, right? So B FAST, when you recognize stroke, would be a similar acronym, right? B standing for balance, back part of your brain, E standing for eyes, any sudden changes in vision. Right, so all very important symptoms to recognize. Now, are there other signs and symptoms of stroke? Yes, absolutely. You can have tingling, numbness in your extremities. You can present with confusion, dizziness, and in the case of hemorrhagic stroke, a severe headache. So the takeaway message of that piece is that it is very important to report your symptoms immediately, even if you're not sure about them, and even if they go away. So a transient ischemic attack, many of you have heard of that as well, abbreviated TIA, right? That's when symptoms occur, but then they resolve. That doesn't mean you don't get checked. You still need to seek medical attention and report those symptoms. Okay, so what happens now when you're having a stroke, or when a patient is having a stroke? What are the treatments that we have? And this is very important. And it ties into the time is brain theme. We have two treatments currently that are life-saving, that help improve recovery from stroke. One is thrombolysis. It's a pretty big word, and it's basically a clot-busting medication called alteplase, which many of us commonly refer to as TPA. And we have another treatment called thrombectomy. And a thrombectomy is a special procedure. It's a surgical procedure where the blockage in the brain vessel, remember we talked about the blood flow being blocked, that blockage gets manually removed with a catheter to restore blood flow to that area, right? That's done by a surgeon. It's a special procedure. Now, both of these are life-changing, and we are so grateful in the stroke care community that we have these options for stroke. Many, many years ago, we didn't have these options. The very important thing to remember with these two treatments is that they're time sensitive, and that means they have to be provided to the patient within a certain time window. So we have 4.5 hours from the onset of symptoms of stroke to administer this special medicine. Now, does that mean you wait until the 4.5 hour mark to seek medical attention? No, absolutely not. The further away from the time of your stroke symptoms, the more you're at risk. So we need to treat you as soon as possible after those symptoms are recognized. And when a patient presents to our emergency department, it's very important to know that we're assessing patients for both of these options, for thrombolysis and for thrombectomy, which is why you need to report those abnormal symptoms immediately, and do so by calling 911. Now, why do we call 911? Why wouldn't I drive myself to the hospital? Why wouldn't I wait until somebody gets home to drive me to the hospital? And the answer is that stroke care begins pre-hospitally, meaning before the hospital, outside of the hospital. Our main provider here for EMS in Yonkers is Empress EMS. You may have seen their ambulances throughout the city, if you're from the city. And their crews of EMTs and paramedics are specially trained in pre-hospital care, especially for level 1 emergencies such as stroke, heart attack, traumas. They're responding to sick patients' locations, wherever that may be, to stabilize them and transport them safely to the emergency room to be met by us, the doctors and nurses in the emergency department. But for stroke specifically, they're also assessing patients for those deficits we talked about and gathering necessary medical information that help us in our treatment decision-making for stroke. And what you may not know is that our EMS crews are pre-notifying us of their and your arrival. And what that means is they're calling us ahead of time so that we're ready for you when you roll in through the emergency department. That patient is seen immediately in the emergency department. So we know you're coming before you even get here, right? And this is all part of the time-saving efforts, the time is brain efforts of stroke care. So our EMS providers are our partners in time-saving and partners in stroke care. So please call 911 when you're seeking medical attention for stroke. And finally, we can't really talk about stroke without knowing what else happens, right? There's more to it. And this is where the multidisciplinary team comes in that I mentioned at the beginning. This is where we're adding or modifying medications. This is where we're doing diagnostic testing, CAT scan, MRI, ultrasounds of the heart and of the neck to check for circulation, cardiac monitoring to look for arrhythmias or irregularities in heart rate and rhythm, rehabilitation, hugely important for stroke, such as physical therapy and speech therapy, really all to give us a better picture and to meet the patient's stroke care needs. So I know this was a lot of information. I do hope some of it at least has been helpful for you. And I'm going to leave you with a simple slide of do's and don'ts for stroke. If you'd like, you can screenshot it. And I will simply say that should you find yourself or a family member in this moment, that you know what to do, and you can be assured of our dedication to you and the excellence in care that you receive from our teams here. So let's take a look at our do's and don'ts slide here. Right, so do make healthy choices, regular physical exams by your provider, medications, right, all the things we talked about, calling 911. And in our do not column, do not put off your regular checkups with your provider. Don't stop taking your medications. Don't ignore abnormal symptoms. Do not wait. Stroke is always an emergency and time is brain. So I'd be happy to answer any questions if there are any.
Thank you, Linda. Yes, we'll start our question and answer segment now. If anyone would like to write in, please look to the question and answer bar that's on the right side of your screen, and we will try to get to everyone. The first question that has come in says, you say I should call EMS with stroke symptoms. I'm afraid to go to the hospital because of COVID. What safety procedures does St. John's have in place to protect me in the ED against COVID? I know you touched a little bit on this, but there are some other things we're doing.
Sure. Wow. So that's a very excellent question. And so let's break it down into two pieces. Let's start first with the 911 piece, the EMS piece. And so ambulances are wiped down with a disinfectant after all calls, right? After all calls, they are wiped down with a disinfectant. And anytime a known or suspected COVID patient is transported, that ambulance is taken out of service completely for a terminal cleaning, a complete disinfection with a special fogging disinfectant, and it's also wiped down. So there are very, very strict measures in place to keep patients and staff safe. As for the emergency department and being here in the hospital, the interventions that I mentioned earlier would be important. The social distancing, everyone is wearing a mask, We're using hand gel. Patients are isolated if they're suspected of COVID, right? So they're removed from the general population. And, you know, now that I think about it, News 12 did a wonderful segment on patient safety and disinfection and cleanliness here at St. John's. So maybe at the end we could put up our social media pages, because we do have it linked to our social media pages. So I would advise you to take a look and check that out. In addition, we have cleaning measures in place in the hospital as well. We have robotic UV disinfectants that are being used. We have fancy electrostatic sprayers and other cleaning practices. So, and again, everyone is wearing PPE. So very, very strict protection processes and cleaning processes that are in place. That was a really great question. Did that answer it? I hope that answered it.
Yeah, thank you. The next question is, which I think we've all heard, is it true that I should take an aspirin if I'm having a stroke?
Right. Okay. So the short answer is no. And there are a couple of reasons. And the first reason is that some strokes impact a patient's ability to swallow. So taking anything by mouth before the patient is checked out would be discouraged. The other piece is that aspirin has mild blood thinning effects, right? That's part of what it does. So if a stroke is being caused by a bleed in the brain, aspirin would absolutely not be given. So that should be avoided.
Thank you. Are there some other signs of stroke that are not so obvious? I know you talked about a few, the obvious ones, but.
Right. So we did touch on them. Altered mental status. You know, the big ones that are the sneakiest and the hardest to identify are the dizzy, the posterior strokes, right? The balance issues, someone presenting with dizziness, someone presenting with imbalance, because those are not the most obvious, like the FAST that we saw on screen. But there could be mental status changes, confusion is another one. But the point is that if it's an abnormal symptom for you, that it be reported and not be ignored, and don't lay down and take a nap, and don't have a sandwich, and don't wait for someone to get home, is to call 911 and seek medical attention immediately. Now, that being said, if there is a concern, we do have telemedicine here, right, which we ordinarily use for the kinds of complaints that you would ordinarily go to telemedicine, that you would go to urgent care for. So minor ailments, sore throat. Now, if there is absolutely no way that you can call 911, which we always encourage, you can call our telemedicine and have a conversation with our emergency room provider. And then they could advise you whether the tingling that you feel in your hand or the symptom that you're having should be treated. And so, again, the primary recommendation is to call 911 and to come to the hospital immediately via ambulance, via 911. But as healthcare providers, we want to serve the community. And so in the COVID environment, we have created this this possibility and this avenue of seeking medical attention and medical help through our telemedicine. And I think also, can we put the telemedicine number on as well, Candace? Is that something we can do?
Yeah, we will have it at the end. We have the urgent care. Oh, okay. Jason put it up. Yes. Yeah, I mean, that leads us into our next question, which so I think you addressed, which is, you know, whether or not, how do I know to come to the ED or use telemedicine?
Right. So I think, you know, we kind of touched on that. Again, our telemedicine is wonderful, and it's basically urgent care telehealth. It's not meant for a medical emergency. It's meant for those minor, as I mentioned, the minor ailments. But again, we also have to serve our community, and we have to be open and accommodating. So again, 911 would be the way to go. But our telemedicine could be used for other things as well, which is a different talk for those minor ailments, sore throat, etc. But the number is up there for you guys to either screenshot it or put it in your phone, however it's easiest for you.
Okay, the next question from one of our attendees is, if I am taking a daily NSAID such as Aspirin, would that prevent me from being a candidate for TPA?
So that's a great question. So there are many criteria for eligibility for thrombolysis. The physician who's treating you, the providers who are treating you, will go through all of those contraindications with you. So they'll review all of your medications, and then you'll decide, they will decide with a conversation whether it's something that's right for you or not. Typically, NSAIDs are not a contraindication, but again, it's treatment is a case-by-case scenario. But it would be very, very important that you share the medications that you're taking with your provider so that the treatment decision-making can be safe and accurate.
The next question is, what if I don't have a primary provider for primary stroke prevention? Can one be provided by SJRH, and how?
So, wow, another good question. So, yes, the answer is yes. We have a physician referral program here that we can find a provider for you. So, wow, that's a great question, because everyone needs to have a provider. Why? Because we have to do all the symptom screen, the risk factor screenings and the checkups that we talked about. And so I think that's probably on our contact number graphic, and we'll put that up at the end.
Yeah, we'll put that up at the end. Anyone else have any questions for Linda before we wrap up? Please send them now.
There was a lot of information at once, really very important information. And again, if there are questions or concerns, you can certainly email them to the email that Candace will put up for you as well. Stroke is a very, very important, stroke care is very, very important. And the information that we shared today is something that you can take home and really implement in your everyday life starting today. And so thank you so much. I hope that it's been helpful for you. And I appreciate you being here with us.
Yes, so a big thank you to you, Linda. Thank you so much.
My pleasure.
Informative. And thank you for everyone that joined us today, and especially to our partners at Yonkers North and the Yonkers Public Library. And if you watched our other webinars, I hope you enjoyed all the topics and our speakers. They are available on our Facebook page. As Linda said, we will put up all of our social media handles at the end of this program, where you can see that News 12 story as well. And if you need our virtual urgent care number, as well as our physician referral number, that will also be up. So thank you so much again. I hope you enjoyed this, and we hope to connect with you soon. Have a great rest of your day.
Thank you.
Thank you.